Good morning, everybody, and welcome to our TLC live, like every Wednesday, except last Wednesday because it was Thanksgiving week. How was your Thanksgiving, Orlando?
It was fabulous. Welcome to our post-Thanksgiving program here at Texas Latino Conservatives. Of course, we weren't on the air last week because we know everybody was preparing for Thanksgiving. We hope that everyone is staying healthy and well and abiding by the COVID-19 protocols because, as we were talking about, this is starting to spread pretty good.
It's going crazy again. Yeah.
yeah.
So, what do you do for Thanksgiving? You stay in town?
Yeah, I stayed in town, and my wife and I went to her sister's house and hung out with her parents. Unfortunately, the weather was good, so we were able to be outside.
I know the whole weekend was raining. It was
Yeah,
horrible.
it was terrible.
So I stay here with my parents and my kids, and then on Friday, I decide to go to Conroe to one of the resorts, but it's something that I booked previous and I couldn't cancel. So it rains the whole weekend. But you know what? It was a good getaway. At least my kids were having a little fun, and we have a get together at night with the kids. And
So did you cook a turkey or lechon?
no turkey. And you know what? I ordered from a local restaurant, Posto
No,
Grill.
so you didn't cook. You ordered.
I ordered, but I cooked the sides.
Okay.
I cooked the side, but I ordered from Posto Grill, my friend Polo. Delicious. The best turkey ever. I started ordering since last year, and it's really, really, really good. So, very well recommended in case that you guys want to order for Christmas or New Year.
Well, we're glad you're joining us. As I said, this is our post-Thanksgiving program, and of course, the election is behind us. We at Texas Latino Conservatives are a state PAC, so we were focused on getting conservative Latinos out to the polls, and apparently it worked, and it worked well. We targeted about 80,000 registered voters in the state of Texas. We focused on 25 state House districts because it was very important for us to maintain the House of Representatives in Austin, Texas. Why? Because next session we will actually be redrawing or reapportioning the congressional districts and the districts that represent you and your local government. So it was important for the conservatives to be at the helm, and we're glad we accomplished that. We don't have all the canvassed votes yet, but the early vote data indicates that the Latino conservatives that we targeted turned out in pretty large numbers. So for all of you that follow us, for all of you that received our text, our emails, our direct mail, our digital ads, our block walking program, we thank you. We thank you for taking time to participate in the political process and ensuring that Texas continues to be the beacon of freedom, of a robust economy. As you know, yesterday, Hewlett-Packard announced they're leaving California and opening up their world headquarters in Houston. And so kudos.
That was a big news.
It's big news, and it's great for real estate development. It's great for employment. It's great economic development. It's good news for Texas because we are the economic engine of the United States. So,
And not only Hewlett Packard is leaving California, many people is leaving California and coming to Texas.
yeah, so for those of you that are leaving California, especially you California Latinos, don't California or Texas. I say that all the time, and everybody gets upset, but it's true. Texas is different. We're different than Arizona, than Nevada, than Florida, and people don't understand that. And people ask all the time, how come Texas Latinos went conservative? Well, the answer is because we're conservative. We're for freedom, we're for faith, and we're for the family. We're for economic opportunity. And we want our children to have a good education so they can prosper more than we have. But there are some issues in our community, and one of the biggest ones, particularly now during the time of COVID-19,
Yeah.
is access to health care, Andrea.
Definitely. And Orlando, I don't know if of course, we all were watching the news. People were traveling during the Thanksgiving week. It was crazy. The airports were packed. And I don't know what part people don't get. That, I understand that people want to get together and want to get away. I did a short getaway just to Conroe, but, people are going to the airports and traveling national and international. And here we go. Now we have a lot of cases, and many counties and many cities around the country are considering another lockdown. And we were having rumors in Texas, and then Governor Abbott said, no, it's no way that we're going to lock down again. But this is very, very important, not only to take all the measurement that, you know, the health department and the CDC is telling us, the guidelines, but also access to healthcare. And that's why we invited today one of our really good friends, well, you good friend, but she is Colombiana, hija de colombianos, Marlen
You take a
Trujillo.
lot of pride in that.
Oh
don't
my
you?
God, yes.
We gotta start finding some Cubans. To be on the program.
every time that it's a Colombiano, and you know, it's in these important positions, of course, you know, it's a lot of proud. So Marlen Trujillo, colombiana, dice ella que su papá es de Manizales, Colombia.
Así es, así que Marlen la conocí yo durante la campaña mía en el año 2001 cuando me lancé para la alcaldía de la ciudad de Houston. Y en esa época Marlen era, nos ayudó a nosotros, era voluntaria en la campaña, ¿no? Y me apoyó mucho, me acuerdo mucho que estaba ahí siempre. Y ella siguió su carrera en la Universidad de Houston y después participó bueno, creo que sacó su doctorado en la Universidad de Texas, lo que le dicen el University of Texas Health Science Center. Así que
But let her tell us the story about herself.
Vamos a introducir a Marlen Trujillo,
the CEO.
el CEO del Spring Branch Community Health Center. Y no solamente es un centro comunitario de salud, pero tiene ya 6 y 2 unidades móviles. Así que Marlene, bienvenida. Good afternoon or good morning. It's still morning. Good morning, Marlen.
Good morning. Buenos días. Encantada de estar con ustedes.
Well, we're delighted to have you, and I know you're busy, especially during this period of time. So, you can stay with us as long as you like, but if you've got to run, I know you've got, you know, a lot of patience. But tell us, you know, give us a little bio. In other words, you know, where are you from? You're perfectly bilingual, so tell us how you learned your Spanish, first of all, and then tell us how you got involved in community health care, and then we're going to get into what is the medical centers there, because they're what's called federally qualified health clinics, as I understand, and I want you to explain that to us later on. But tell us a little bit about you.
So I am from Houston, Texas. So I was born here, raised in the Spring Branch area on the west side of town. I am a proud product of the public school system, so did really well. But in high school is when I actually became very interested in politics. So I was very involved in student council, doing all of that, of course, and helped a couple of volunteering in a couple of campaigns, and that's where my interest grew. I did go on to the University of Houston, you know, went into the business school there, received a finance degree, and that's when I started volunteering for your campaign, Orlando. Cuando estaba en la universidad es cuando estuve voluntaria en tu campaña y creo que mi interés por ayudar al público, ayudar a la comunidad nació desde pequeña porque siempre estuve envuelta en muchas organizaciones, en muchos eventos, en dando más a la comunidad, más información y dedicada a servir al prójimo. Creo que es mi interés y ha sido mi interés desde hace mucho tiempo.
It's one of the
that's how I started.
Yeah, that's well. Thank you. You know, I can never thank enough the volunteers that helped me in that historic 2001 campaign. You have to admit, Marlen, it was a lot of fun. We really enjoyed it. We fell short, but you know, I remind everybody, it's still the most historic race in the history of Houston.
I remember I was doing the news in that time.
Yeah, and you know, historic because we voted more people in the runoff than voted in the general election.
Yeah.
I don't think that's ever been done. So, thank you for your involvement. You know, I'm really proud of you because I've watched the Spring Branch community health centers grow over the years, and you know that's quite a feat. It's I'm assuming that you're a nonprofit, correct? And you have a community board of directors. Am I correct?
We are, yes. It's a 501c3, but it does receive federal funding through the Health and Resources department. So we do receive federal funds, private donations, and also our fee schedule in order to collect some dollars from the patients at a nominal fee.
So Marlen, tell us about the community centers and what is the services that you guys provide over there.
So, you know, just taking you back a little bit, our, you know, our organization was created by community leaders. So through my church at St. Jerome is where we created this charity clinic back in 2004. There's a group of us really concerned with the health care that was being provided in the Spring Branch area. A lot of women that were pregnant, uninsured, were dropping into the ER, and we wanted to do something and take care of our community. And we became a charity clinic, but through the Bush administration in 2005, we were able to apply for federal funds in order to become a federally qualified health center, which are dollars that are designated to medically underserved areas. Where there's health disparities, where we need to provide access to health care. And that's how we got started, long time ago, but that was our early beginnings.
Marlen, you talk about access to health care and health disparities. You know, it's a big issue. I talk to a lot of state representatives and state leaders in the state of Texas. I'm sure you're aware because, you know, you're dealing with this issue every day of COVID-19, but the Latino community has a higher percentage of morbidities and is more susceptible to, the fatal aspects of COVID-19 because of what we call our comorbidities, right? These are our underlying conditions that make it difficult to overcome. What, in your opinion, is a way that we can begin to address educating the Latino community? You know, one of our focuses is trying to curb this, path we're on, especially with juveniles towards, type 2 diabetes. But how do we avert these early onsets of diseases that create those comorbidities for us?
So yes, you're right. Especially in the Hispanic or Latino community, diabetes is kind of a big issue and concern in our community. What we've done in our health center is try to create more awareness, a lot of health promotion, a lot of health education. The reason why we have mobile health clinics is really to go out into the community. I'm a firm believer of grassroots movements, of going into the community, walking, knocking on doors, talking to individuals, not just passing out flyers. I'm not a fan of that. I like engagement. I like communication. So my staff is very well committed to serving the residents in the community and educating them on these chronic conditions that we're experiencing in our communities and across the nation. But I think a lot of education is needed. We've done a lot more of that. Nutrition classes need to be accessible. We do have that in our community health center, and you just have to make them free and accessible. It's really hard to create a healthier community when you have to pay for every single thing. So I think that's what's needed, and we try to do a lot more of that, but the resources are limited. But in our population, I think that's the better way to serve them.
I'm going to let Andrea ask the next question, but real quick, can government be a partner to you in the education and nutrition, particularly the nutritional education side?
Absolutely. I mean, absolutely. I know we've been working with all of our healthcare government entities, I guess, or state entities in the Houston area. There's got to be some collaboration there, or else we all fail at it. So absolutely.
So tell me about these community health centers. What is the service that you guys provide, especially now with this COVID-19 situation?
So we're a primary care facility, which means we provide medical services to the uninsured, underserved, and people who really want a community clinic and have private insurance. So we see everybody. Anybody that walks in the door can be seen by us. But we do have family medicine doctors. We have internal medicine. We have pediatrics. We have OB-GYN. We also have complementary services that include behavioral health, mental health services, and dental services. So that's the array of services that we provide to the entire community. So it's what it says, a community health center. It's very inclusive of all of the above when you walk into our facility. And most recently, we were just awarded housing dollars through the city of Houston and the state to be able to address homelessness in the Houston area.
You know, it's an interesting point, homelessness. I call that a euphemism. You know, unfortunately, many moons ago, the United States, as a matter of public policy, decided to deinstitutionalize individuals that had mental health challenges. And, you know, to me, and, you know, the O in my name is not Orlando, it's opinion. Uh, It's one of the cruelest public policy decisions that I have seen in a long time. Obviously, the decision to abort children at just about any time, and you know, even if they're born alive, you know, do away with them. But to deinstitutionalize and not provide services for the mentally challenged, I think is fits in right in the definition of cruel and unusual punishment. I know that there are a lot of issues that address, you know, that pertain to homelessness, economic, you know, devastation. People find themselves without a job, high debt, they have no place to live, they're evicted. But I think those are not the largest percentage. I think the largest percentage are drug and alcohol abuse, substance abuse, and of course mental health issues. Am I right or wrong on that?
We have a large, we have a large community that needs mental health access, and I think what we're trying to do in our community health center is really provide a holistic approach to health. It's not just going to the doctor and seeing them for 20, 30 minutes and walking out the door. You really need to be connected to other social services that really impact your health. So from our perspective, we're trying to provide everything, whether it's connecting you to a food pantry, connecting you to a resale shop, connecting you to housing services. We're trying to really create a laundry list or long list of other services that you can access when you come for medical care. Oftentimes I've heard, someone walks in and they have abdomen pain. In our community, abdomen pain or stomach pain could just be they haven't eaten. They don't have food on the table. And mental health is another area that we have been provided additional dollars through the mental health services agency and through some of our private foundations to address that need. And it's a huge need. And unfortunately, in our Hispanic Latino community, it has become a taboo. When we talk about mental health crisis or behavioral health, o es que él va a ir a loco, está loco, no sabe lo que tiene. Or, we always, say the crazy doctor, or you're going to the crazy doctor. No, mental health is much more than that, much broader. There's anxiety. There's a lot of anxiety right now because of COVID. There's a lot of depression right now with people being isolated. So, providing all of those services, Andrea and Orlando, I think, it's necessary. We have to provide everything, not just a prescription, from the physician.
So what are you guys are implementing or changing, and what is the plan for 2021? Now with COVID-19, increasing the test or, have a mobile test, or maybe, now with that they're talking about the vaccine. What is the plan for 2021?
So we have been testing. We have a good partnership with the city of Houston, and we've been providing COVID testing at one of our locations. So we are going to continue doing that. We've been going out in the community, handing out masks, and making sure they're educated, they understand, that our community needs to protect themselves. But in the new year, we're really taking advantage of telemedicine and telehealth. It's an area that we had as an option in our health center, but it wasn't really popular. It wasn't really used. And since the pandemic and COVID, a lot of our patients have utilized a telemedicine option that we have to talk to their doctors. They're not comfortable walking in, but we want them to still access healthcare to stay healthy. Come and check your blood pressure, come and check your cholesterol levels. But telemedicine, I think, is a new area that we're going to have to continue to provide. And I think that's the big game changer in our healthcare industry.
Do you have a geographic limitation? In other words, do you have to be a resident of certain zip codes, or do you attend to any patient that walks in your door?
We are designated funds for certain zip codes and census tracts, based on our program requirements, but we can see anybody. They're not restricted to that individual. Our criteria doesn't, doesn't I guess eliminate the opportunity to help everybody. But
So
the
let's
funds are
say,
designated based on census tracts and underserved communities.
so if someone comes from that census tract or that designated zip code, there are funds that can supplement. But let's just assume somebody that's has no health care, no income, and is from another county, let's say, 2 or 3 counties removed, you will still provide a service.
Yes, we can provide the services to anyone from any county. Let's say they're visiting from Florida, we can provide services. That's not an issue. That they're visiting from Mexico, that's not an issue. We can provide it. The only thing that makes it a little bit challenging is if they're from another county, from Harris, not Harris County, and we need to refer them into specialty care or connect them into specialty care. Sometimes accessing some of these other healthcare services it is restricted. So that's where it gets complicated. But other than that, we can see anybody from anywhere.
I want to talk more about the telemedicine, Marlen, because I associate this telemedicine with the issues that the kids are having in the school, virtual school. Many kids, and I was reading an article on the HISD that many kids didn't really get access to the education because of lack of technology, Wi-Fi, and the parents were not on top of that. It was a lot of issues, and I believe it's the same issues or the challenge that you guys gonna face with the telemedicine starting next year, because it's a new era. Definitely, not everybody knows how to manage this telemedicine. The technology, how to connect with the doctor, how to connect with the clinic through the phone, through a computer. Many people don't even have computers. So how is gonna work these things?
So we've done a lot of kind of studying, and we do some marketing surveys. We also do some community needs assessment, and we realized that a lot of our patients, the majority of our patients, use the internet through their cell phones. So we took that information and we created friendlier opportunities for them to log in to telemedicine. And we also had to do a lot of education over the phone. Push here, click there, download there, and we had to do it all in Spanish also, because the majority of our patients speak Spanish. But I think it's going to require a lot of education. Some people don't have the devices. We're also looking into that. We just received another access to another program that is actually putting cell phones in the hands of patients that don't have access to cell phone or internet. And that's the vehicle that we're going to be utilizing in order to make sure they take care of their health. We also have access to internet when you're in our lobby. So what we did is we extended our internet into the parking lot. So if someone drives up to our health centers, you can access our guest Wi-Fi, and then also through our mobile health clinic. So yes, Andrea, it has been, so difficult to connect to our patients because the education that we have to do for technology, itself, it has been a challenge, but you know what, we've made it work. There's a way to do it. If we can get a device in front of individuals, or we can teach them and they're able to, they can connect to healthcare services. And we've seen those types of successes in the past 6 to 8 months.
Marlen, I want to go back to sort of the nuts and bolts of the practice. Suppose, and I know that you operate as a primary care facility, family practitioners generally, but when somebody presents themselves and it's obvious that they're diabetic, obviously they're going to need, let's say, a specialist, right? An endocrinologist or somebody may have a cardiac issue. How are those patients referred out? ¿A dónde los mandan? Si las personas no tienen los recursos para pagar, they don't have the money to pay for it, ¿cómo los pueden asistir ustedes? How do you help them?
Orlando, los especialistas no los tenemos en la clínica, pero tenemos las relaciones y podemos referirlos con el especialista. Y es un poquito complicado. Estábamos platicando del tema anterior de qué condado pueden venir a ver a los pacientes. de qué condado, si está restringido los fondos, pero tenemos el acceso a los servicios del condado de Harris Health y es como conectamos a los pacientes. También tenemos especialistas en el área privada que tenemos relaciones con ellos de dar un especial, un descuento a los pacientes. Entonces sí hay formas de conectarlos, pero sí se complica un poco, es un poco más difícil porque realmente no tienen seguro médico. Entonces es un poquito más difícil, pero como quiera tenemos el acceso y las relaciones para conectarlos con esos servicios.
It's something that's always fascinated me because, as you know, hospitals are, well, as you are, a 501c3, usually nonprofit, and they're, have religious organizations behind them, whether it's the Methodist, whether it's the Episcopalians, and even with St. Joseph's, the Catholic Church. Most of those hospitals, Marlen, have, foundations or dollars that are available for charity care. I mean, the reason they are a 501c3, a nonprofit, is with the expectation from the tax code perspective that they'll provide some level of care to the indigent. So when you say, we refer them to specialists, or for example, do your relationships include, MD Anderson, a Methodist, Memorial Healthcare System, that they have designated, yes, we'll take in a certain amount of your patients that you refer at either a discounted or, let's say, from a charity perspective, at no charge. Do you have those sort of arrangements?
We do. They're limited, but we do have one arrangement with Methodist. West Campus, we have a network of care where clinics like ours in the Houston area are referred patients from the hospital ER into our clinics. Individuals that walk into the emergency room that don't have insurance, the hospital wants to connect them to primary care and regular care. So we have that relationship there. We also have a relationship with MD Anderson for cancer patients. And, we're able to get them into the programs that are accessible for the low income or uninsured. So those exist, but they're very limited, Orlando. It's just our healthcare system is sometimes hard to navigate. But I know those two programs have been very well received by our community because it's allowing them to get the care that they need.
Marlen, have you guys have talked about what is the plan for the vaccines, especially for these families in need?
Yeah, that's a great question. And are you, once the frontline folks and those at high risk are inoculated, vaccinated, will your clinics be participating? Will you be getting the vials of any approved vaccine?
So I'm sure you heard yesterday that the CDC made the final decision, or the committee did, on who's receiving the vaccine first. So healthcare workers and the nursing homes will be receiving the vaccine first. Now, as far as our health center, we have already been in planning discussions and meetings about how to receive. Once the vaccine is distributed into the communities, we are on the list to receive the vaccine. We are just unsure as to which one we're going to receive, when we're going to receive it, and what are going to be the marching orders to distribute it, because we know there's kind of a phase approach to the project.
I'm sort of curious. So how does this work? Do you as a consumer get a choice between Moderna, Pfizer, Merck, whoever comes out, or do you just get what the government ships that's been approved by the FDA?
We have been told we were going to get what we get. So I don't know if we're going to get one that's 70% effective or one that's 90 or 95. We don't know yet. So yeah, once that we get that phone call or that email, we will have, I guess, a better idea of what to do and how to distribute that, because that's going to be the logistics of that is going to be the fun part is, how do you make sure you're giving it to the health worker or the prioritized individuals for that month when we receive it. So yeah, but we don't know, Orlando. So I would like to know soon so we can plan, because there's so much to do in the community.
I know everybody, it's more questions than answer right now. What about prices and if people has to pay and if somebody who qualifies, if it's for free? I mean, it's been talk about that.
But I think the administration's already said that the vaccine
It's going to
is
be
going to be
free
free
for
for
everybody.
Yeah, is that true, Marlen?
Yes, that's what
It's
we
going to be
heard
free.
too. Yeah.
So
Yeah, our
there's no
COVID
cost.
testing has been free for uninsured, but overall, there's testing sites all over that are providing it for free. I think the objective is just to make sure that we vaccinate the entire community so we're all much safer together.
I think the challenge that, probably your community health center and, physicians are going to face, the healthcare industry, is the reluctance of folks to subject themselves to the vaccine. I mean, I hear quite a bit of that rumbling around. Um, but it's true that you have to vaccinate a certain percentage of the population for, I guess the lack of a better word is, by eliminar or to extinguish the virus, correct? I mean, you have to create a
Right.
certain percentage of what's called herd immunity.
Yeah, I've heard that too. Immunity across the communities. And that's the concern. Yes, you're right. That's the biggest concern. Some people will refuse to get vaccinated. I don't know how that's going to plan out for us, but we also have been talking in our health center. What about our employees? We require the flu shot for our employees, but they do have an option to sign a little waiver and they can bypass that. So we don't know what's going to be the directive that we're going to receive with the COVID vaccine. If we're going to have a mandatory, order to make sure all of our employees are vaccinated. So at all levels, Orlando, I think it's a question mark right now. We're just waiting. We're waiting to hear, what we're going to be required to do.
Yeah, that was gonna be my question because I was reading Marlen and Orlando that normally a vaccine it takes between 15 to 20 years to develop, and this COVID-19 vaccine it was like fastest process ever in history. So many people are like saying like I don't want to be, I don't know how to say that in English, el conejillo de Indias.
The guinea pig.
Yeah, I don't want to be like that, yeah. So many people are afraid, I mean, and skeptic about that.
Well, and it's not just here. I mean, I have friends in Mexico and family in Mexico, and they're calling, what are you guys doing? What are we doing?
Yeah.
And they have vaccines. Mexico is, working on that and purchasing. But they're having the same challenges. The community is very skeptical about the vaccine, especially, the first wave that gets shipped out. So yes, we're going to have to do a lot of education. We're already logging into conversations and webinars about how to, talk and educate the community about about the vaccine. And we need to convince them that it's necessary for all of us to go back to some sense of normality. It's just going to be something we do.
So I want to now, we've got a few minutes left. I'm not going to keep you the entire hour because we know you're busy. What are the future plans for the clinics? I understand you have 6. Will you give us the geographic or the general location where people can access healthcare in and around Houston?
Yes, absolutely. We're one of 12 community health centers, federally qualified health centers in the Houston area. You can find an FQHC all over the nation. Any city you go to, the majority of the major cities have FQHCs. But we continue to grow towards the West Houston community. Our target population, our service areas are 610 West and up North 45 Northwest. So that left quadrant is what we have been targeting and trying to make sure that we can reduce health disparities in those communities. We do have 6 locations. 3 of them are in the Spring Branch community. Because of the population there, we have a lot of individuals that we take care of. So 3 of them is not even enough for that population there. And then we've got 1 in Katy, 1 in Cy-Fair, and then 1 in the west side of town. So geographically, I'd say positioned in order to serve the entire greater West Houston, as I like to call it. of communities. And we are still not at capacity. We still have an opportunity to add more physicians to our practice, especially in the Cy-Fair area. But there is opportunities to add more. We make our decisions based on the need, but also based on funding. So we hope that we'll continue to receive funding through the health center, community health center program. And we do always have great bipartisan support from both sides of the fence. So we're thankful for that, because what we do, is to serve the community and overall to just help all of us, be much healthier and have healthier communities where we can live and thrive throughout Houston in general.
Marlen, definitely we're never going to be the same after this 2020 pandemic. What is the things that you guys have been taught in the centers to stay forever? Like the mask use, or what is the guidelines that even if it's a vaccine for everybody, the COVID-19, and people start like talking less cases or whatever, you guys gonna have something forever? Or is any talk about that?
So, we had to change a lot of things. We had to put splash guards in our community centers, in our buildings. We had to put stickers on the floor, as you see at the grocery stores. We had to, make sure everyone gets handed a mask. We have isolated rooms. If we know someone has COVID, we have an isolation room for them. And, the provider has to gear up. But I think it's definitely a change in our lives. I know the Latino Hispanic community, we're very touchy-feely. Somos bien cariñosos. Nos encanta saludar de beso. Nos encanta dar abrazos, apapachos. And that's going to change. And that's going to change. I think that, to me, is the major, I guess, challenge for us as a community, because of our upbringing, because of our culture. And I know that our community enjoys it when the physician touches their shoulder, or, gives them a side hug, un abracito de lado que te dé el doctor, es lo que necesita la comunidad. Pero con estos cambios, yo creo que ya no se va a poder hacer eso. Creo que nos vamos a dar besos de lejos, saludos de lejos, desafortunadamente. But I do think it's a major change, even in our healthcare industry, because empathy is a big part of what we do, and caring and providing trust to the community. And you do that not just by talking to them, but by touching them. Yeah. Because we're a very, very nurturing community in itself. So I know that'll be the hardest thing, is how do we provide, continue to provide quality care, but show that we care to our patients when they're in the exam room. And with the face coverings, it's hard to listen. It's hard to hear. I look at people's mouth when they speak, because, I'm listening, and I can't do that anymore. And it's so hard. But yes, face coverings, as far as our chief medical officer has said, his opinion is that we are going to be in this for a couple of years, if not longer, where we're going to have to wear face coverings and hand sanitizer everywhere. I mean, we already have that in our healthcare industry, but now it's probably times 3. We have to do it much more often than before.
All right. So what are the future plans for the community health centers? And tell us a little bit, both in Spanish and English, for those that are watching and have family friends with, that are unemployed or have hit hard times, how to access the centers. I mean, is there a phone number? Do you give us your website? How do you begin the process to be seen by a general practitioner in your clinic?
So all the FQHCs have a similar eligibility process. We all have a sliding fee discount. We discount our services to individuals that qualify based on their income, their household income, and the number of individuals that are in the household. So we follow the federal poverty guidelines, and all of us are mandated to follow those across the nation. But in Houston, we have several federally qualified health centers. We all have different numbers. Obviously, we all have different boards. But our community health center in the West Houston area, you can access us through the phone number. So I can definitely, give you that. It's 713-462-6565. And also our website. Our website has a list of all the centers, and I think you showed one earlier. That's our Cy-Fair location. Our location in Cy-Fair provides dental services and family medicine, pediatric services as well. So any of our locations can take care of an individual, but it's based through income if you want to receive the discount. Other than that, if you don't want to apply for the discount, you don't want to qualify for a sliding fee scale, you can just show us your health insurance card. We provide great quality health care, and we also take care of the uninsured and the Medicare population. We're starting to venture into the Medicare population a little bit more through telemedicine, because we know individuals don't want to leave their home, but they can certainly visit with a doctor through their phone or their device through telemedicine. But we don't have one website, Orlando, other than HRSA.gov, HRSA.gov. You can find a health center anywhere in the country through that website as well. If you're, in another city, or if you, are visiting, you can find your closest community health center in the neighborhood through that website as well.
Marlen, one other question. There are people that like to save money. For example, and a doctor may order a CBC or a liver panel or whatever, or a chest X-ray. How does this work? In other words, can I walk into the clinic and request a chest X-ray or some lab work? And what I'm getting to is it more economical to go through the community health clinic, pay cash, than it would be going to a physician?
It really depends, Orlando. We certainly welcome anybody with insurance. Our fees are comparable, but they're probably more reasonable than a private doctor. And if you have health insurance, you can definitely see any of our providers. But some people have, depending on their deductibles and their co-pays, sometimes it's easier to not run certain charges through the insurance and just pay cash. And I personally have done that. Have a high deductible, so it's easier to pay for the ultrasound or X-ray for $500 or $350 down the street, and still have them send those results to my physician without running it through the health insurance that I have. So it really is on a case by case.
Yeah, it's interesting you say that. I mean, why would you not want to run it through your insurance? Doesn't that, even if you spend $250 for an MRI or $350 for an MRI, or a series of X-rays, isn't it beneficial to apply that to your annual deductible?
It is, but not if you're at the end of your annual benefits, right?
I don't know, run that by me again.
Sorry, so you get credit, I guess is what you're referring to. Through your deductible, you have to meet a certain deductible. But if someone has a $3,500 deductible or a $5,000 deductible, some of these plans that individuals have signed up for recently, they're not accessible. It's hard to reach that $5,000 deductible. So sometimes it is easier to just get a cash option. And also some of these plans, they require you to go to your primary care provider first, and then get a referral into specialty or a referral into what you need. And sometimes you can bypass that. I mean, all of us have the opportunity to do that, but it really is dependent on their health insurance coverage and their deductibles that they have signed up for. Some of these plans, Orlando, as you know, are catastrophic plans. They don't really provide wellness exams or, routine healthcare benefits. So it's just dependent really on the plan.
Yeah, I mean, I
but
think
anybody
that's
can
what
come to our health
it's,
center.
yeah, it's like, our deductibles are so high that there is no primary, just your annual health checkups you got to pay out of pocket, and then pay a sizable premium every month. So at the end of the year, you've paid $6,000, and let's say you have a $3,500 deductible, you're paying almost 10 grand for nothing.
Yeah.
I mean,
Right.
well, you got
And
to, yeah.
I'm glad you bring that up because I failed to mention that we do offer services to the underinsured as well. So it's not just people without insurance, it's underinsured. So those individuals would be considered underinsured and they can apply for our special discount. And that's where their fees are much lower through our health center. Yep.
Well, Marlen, thank you so much for your time. It was definitely a lot of information, very helpful in the community. And we'll probably get back with you next year to see how you guys are doing, what is the telemedicine working for the people, and give more information because definitely, as you said at the beginning of the program, the major challenge is the lack of information that people has these days.
And Marlene, I
Yes,
want to,
definitely.
I'm sorry, go ahead.
I would love to come back and let you guys know how we're doing that in the community and really share the resources and the services available once we get the vaccine.
Yeah.
Pues Marlene, te felicitamos por has sido completamente dedicada a la comunidad desde que te graduaste de la universidad. Así que, cheers for you for helping improve Houston. We wanted to highlight you not only as someone that's politically involved and especially with public policy issues with respect to health care, but someone that is the child of immigrants, a fellow Latina, a leader in the community, and someone that's made Houston better. So, I've had the pleasure of knowing you for a long time, and I'm extremely proud of you. I just think you do a marvelous job in the community, and I want to wish you the best for you and your family and for
Thank
your
you.
community centers. And yeah, anytime you have something important to share, please give us a call. And we do this every week. And we try to inform the community and give them options, whether it's respect to, education or healthcare or economics, the political process. We want to educate the Latino community and get them more involved. We've taken for granted, well, I don't want to get too much into politics because that's not your wheelhouse, and I don't want to put you. But we are a conservative group, but we want to highlight the conservatism of the Latino community. So we bring them all this information because I think for far too long the liberal left has taken the community for granted. That they're going to vote for us, and they were in for a big surprise this year, particularly in South Texas, but. Don't want to get too much into politics right now. When you go off the air, I will. But thanks again.
Yes, I don't want to get in trouble. I have to be very, very politically correct. Sorry.
That's right. That's right. But look, if we don't see you again before Christmas, Merry Christmas to you, your family, your community. Stay safe, and thank you for the generosity of your time.
Thank you. Thank you to both of you, and a pleasure meeting you, Andrea. I'll see you soon.
Lo mismo, Marlen.
Bye-bye.
Muchas
Thanks,
gracias.
Orlando.
Chao, chao, y que pases una feliz Navidad y Año Nuevo.
Gracias, hasta luego. Chao.
Hasta luego. Chao.
Chao.
Así que un placer tener una líder en la comunidad.
Una colombiana, inteligente,
mexicana.
bella.
Colombiana,
bella.
Dale crédito a los mexicanos.
No,
también.
yo amo los mexicanos, tú sabes que sí. La mayoría de mis amigos son mexicanos, yo los adoro, pero de verdad que es rico sentir que cuando traes una colombiana, sobre todo colombiana, mujer y en una posición, no solamente lo importante de la posición, pero lo que da la comunidad, lo que presta la comunidad, lo que representa en la comunidad. Y eso es bien bonito porque pues yo vine a este país inmigrante hace 23 años y eso es lo que somos, ¿no? Que venimos a este país a hacer mejor este país.
A contribuir.
A contribuir.
Yeah. No, es un orgullo tenerla en el programa y parte de la razón porque la tuvimos es para compartir con la comunidad el orgullo que tenemos en los inmigrantes y hijos de inmigrantes. Sabemos que Marlen nació aquí en Houston, así que es tejana y es de Houston, pero me imagino que para sus padres eso es un gran orgullo. Ha recibido su doctorado, ha creado 6 clínicas en la comunidad, clínicas comunitarias, como ya oyeron, dan servicios a un descuento a las familias que no tienen seguro y no tienen bajos recursos. Así que we're really proud of her, and we wanted to highlight Marlen. She's the daughter of immigrants. She went to school here, earned her PhD, has helped create. She didn't do it alone because I know she has a magnificent board of directors that are business leaders and community leaders that help her. And but she has guided the organization through the maze of the political process. She's been able to acquire, funding from federally qualified health clinic program, which is very important. She has partnerships, as she mentioned, with Methodist Hospital. Uh, you know, it's just amazing what she's done to give access to an underserved community in Houston.
And these community centers are very important, and I wish we have more through the community, because definitely when you need primary care, you don't know where to go. It's very expensive, and going to hospitals it's not that easy. It's not accessible unless you go to the emergency room, and you have to wait hours and hours. So we need more of these community centers. Go back to the barrios, en los barrios, en
Correct.
las comunidades.
Así que para los que necesitan consultar con un doctor o tienen no se sienten bien o quieren ir no tienen que ir al salón de emergencia, pueden ir al Spring Branch Community Health Center. Pueden accesarlo por el internet o el teléfono que ella nos dio.
Sí, ya lo pusimos en los comentarios, ahí sí, ya lo pusimos, así que lo pueden ver ahí.
Es fácil, no dejen de ir al médico, no dejen de hacerse sus exámenes, no dejen que si se sienten un poco mareados, están sudando, puede ser diabetes. Eso se puede descubrir fácilmente con un análisis de sangre, pero eso lo hacen todo en el centro comunitario de Spring Branch. Así que
salud mental, Orlando, bien importante, salud mental, porque a veces...
Particularmente para mí ahora.
Sí, exacto, tú necesitas bastante consultoría en salud mental. Pero de verdad, salud mental, estaba leyendo que en Japón han habido más casos de muertes por suicidio que por COVID-19. Y estamos viendo... Inclusive este año, aquí en los Estados Unidos, sin irnos a Japón, irnos a otro país, aquí han incrementado los casos de suicidio durante este año, los casos de violencia doméstica, los homicidios, los divorcios, y esto todo tiene que ver con estar encerrados, con el estrés que ha causado la pandemia, el haber perdido el trabajo, el haber perdido... No tener ingresos, haber perdido familiares que han muerto por COVID-19. Todo lo que ha pasado este año de verdad que nos deja muchas cosas que pensar, que reflexionar. Estamos empezando el mes de diciembre, bienvenido diciembre, estamos en la cuenta regresiva para terminar este año 2020 y muy ansiosos de lo que nos espera en el 2021, porque yo me acuerdo en enero del 2020, yo inclusive lo puse en mis redes sociales, 2020 es la mejor visión, y pues... Ya, no sé, ya 2021, ya mira, ya ni decir nada, porque de verdad que este año nos trajo tantas cosas que históricamente nunca habíamos visto, nunca habíamos vivido y padecido, y no sé qué va a pasar en el 2021, pero aquí estamos.
We as Texans, of course, have the great fame of being optimistic.
Yeah.
We look for a better future, and that's what we wish for you. This has been a tough year. But we hope that 2021 is a lot better. We hope that you have a great Christmas with you and your family. As conservatives, we don't like government telling us what to do. We don't like government picking winners and losers. We believe in a free society. But there is a lot of good scientific information that the healthcare industry and scientists around the world put out. I, as a conservative, it makes sense to me to wear a mask. It makes sense to wash your hands constantly. I mean, that's just good hygiene practice, And it does make sense in the time of a pandemic to follow the guidelines that it's probably not a great idea to be concentrated in a small room with a bunch of people. But I think people should be given the information and let them make their own decisions. And I think that scientists are putting out good information. So, we're at the end of our program. We thank you for tuning in. We'll be back next week, as we are every week here, and hopefully we'll have another informative program. But our mission is to educate, to motivate, to engage the Latino conservative community so that you participate in the political process, and when it's time to vote, as you did in November, we want you to do it again. We want to expand the Latino conservative voice in the state of Texas. We've got a lot of work. Election coming up again in 20 months. We've got to get, 23 months. We'll have another election.
We're getting ready from now.
And so we need you to register to vote. We need you to tune in, check out our website. If you're a young person that wants to get involved in government or in the public policy process, or you want to run for office, you want to become a precinct chair, you want to manage a campaign, we have what we call Leadership Latino. And so we have these programs that we give you a one-day seminar and try to give you as much. It's like drinking out of a fire hose, but we try to give you as much information about what you need to know, the tools that you need to be an effective campaign manager, a precinct chairman, a candidate for office. So go to our website, it's TexasLatinoConservatives.com, and up there on the far right you'll see a drop down that says Leadership Latino. Go there, sign up for our next class that's going to be sometime in January in the Dallas area. We have them across the state of Texas, so we look forward to seeing you there. And always drop us a note. We love to hear from you. Let us know where you're watching from. And so we want to wish you the very best for Christmas. Merry Christmas and
Happy New Year. A happy
We'll wish Happy
2021.
New
We
Year.
need,
Yeah,
we
we
need.
Bye, guys.
We need a Happy New Year. Muchas gracias a todos. Nos vemos el próximo miércoles. Chao, chao.